director of the European Monitoring Centre for Drugs and Drug Addiction, is the agency behind the report. Alexis joins us now from Lisbon. Thank you, Alexis, for your time. Your report suggesting that drug prevention and counter-narcotics operations have had to reduce their work because of coronavirus, but the drug manufacturers and drug gangs are innovating. Does that suggest that the battle is currently being lost?
Merhaba, and thank you very much for the invitation. No, certainly not. What the report suggests is that certainly the COVID pandemic had as a first phase a disruptive effect, both on the retail market, due to the fact that since there was a lockdown, people were not allowed to circulate in the street, which also had an impact on the level of the retail of drugs. There was also a negative impact because some of the measures led to the closure of treatment and harm reduction services. But in the same way that in the normal economy, the organized crime has been extremely resilient and has found alternatives using more social media, darknet, and other ways and means to provide and supply the drugs to their clients. Still, for some substances, there was a significant decrease during the lockdown period.
How much does the European Union need to work with agencies or countries that are outside of the bloc? How much of the EU's drug supply comes from within the EU and how much from other continents?
Well, the supply of drugs can be defined as such. You have the plant-based drugs, mostly cocaine and heroin. They come from other areas from the world, while for cannabis, the European Union has turned itself in the last 10 to 15 years in a major producer, especially of herbal cannabis. While we speak about chemical or synthetic drugs, there we see that there is a different situation. But having said that, the European Union is the unique and main producer of ecstasy or MDMA that is distributed worldwide, while there are other drugs circulating to and from the EU, such as stimulants like amphetamines or methamphetamines. There we see appearing an increased role for organized criminal groups from outside the EU. For instance, we discovered last year a laboratory with industrial capacity for production of methamphetamine that was controlled by the Mexican cartels.
Alexis, do you find any particular reluctance from the governments of member states to address the issue of demand? Because when you look at it as an issue of demand, you have to admit that actually you have a problem in your society. So you address your own concerns. If it becomes a problem of supply, you can blame illegal actors and external actors for the problems that illegal drugs are creating.
Well, in the European Union, we have a very specific position for more than 25 years now, which is what we call the balanced approach, which is basically that since the beginning of the heroin epidemic, and this has led, among others, to the establishment of the drugs agency, what we see is that the EU member states, with the coordination role from the European Commission, have developed a coordinated and balanced approach combining supply reduction interventions and demand reduction. And you can see the result of one of the expressions of that by the very strong position that the EU has been able to take at the UNGAS in New York in the General Assembly Special Session on Drugs, where there was a European position gathering the 28 member states' opinion, supported by and presented by the European Commissioner. And I think it is in that context that also Turkey contributes and participates as a full member of the work of our agency.
Alexis, thank you for joining us. Really appreciate it. Alexis Goosdeel in Lisbon.